I work as a career and business coach. Before that, I used to work as an architect. I was a designer for many years, and about 10 years into my career, I got injured. And I was feeling pretty sorry for myself, and one day I decided to take out a Post-it, and I wrote down 10 things I'd always wanted to do in life, which included things like do acting, act in a play, make a film, write a screenplay, studied stand-up, and I wanted to also go get an MBA and go to an all-women's college. And I actually did all those things. So on this journey, I learned a lot about myself, and most importantly, I learned about fear and how to manage fear.
Jenn first saw me in the office because she had felt a new mass in the upper outer part of her breast. And when I saw her, I felt this mass, and it was movable, but because it was a new mass and it was slightly irregular on imaging, we decided to do a biopsy. So I offered her an ultrasound-guided core biopsy in the office, which we did, and it did end up showing an invasive ductal carcinoma or breast cancer.
I think I was in shock and disbelief because my life was going so well. I had the dream job that I'd always wanted, the career that I always wanted, the lifestyle that I always wanted. And so to get the diagnosis was shocking. And people couldn't believe it because, I looked to be in great health.
I think she was traumatized and surprised that she had this diagnosis, which a lot of young women who get breast cancer are.
When you have breast cancer, you're going to have these doctors for at least 5 to 10 years, if not more. So the relationship with the patient-doctor relationship is really crucial. When I met Dr. Goodwin, who did the biopsy, my first impression of her was that, I really like her, but I was also thinking it'd be fine if I never ever saw her again. But of course, that's not what happened. I did have to see her again. And so I think I just trusted that intuition and that sort of, first exchange.
I talked to her about all the options of treatment, and this was a pretty small tumor that did not appear to have gone to her lymph nodes at this point yet. And so she could start her treatment with surgical options first. And we talked about the options of lumpectomy versus mastectomy. And she chose to undergo a lumpectomy.
She, as would be expected, did very well with her surgery, did very well with her radiation.
I'm not saying it was easy, but I think that having had gone through a crisis before and having developed certain tools about how to have a positive outlook, to look on the bright side, see the world as, the glass is half full, definitely helped me along that journey. It was terrifying, certainly, to think that I might die sooner than I expected. And every step of the way was like climbing a mountain. But I think I was just very sort of determined and driven to make it through.
When we were talking about putting her on hormone blockade, which is what was recommended for her, she had trepidation and worries about taking the hormonal blockade. So I tried to reassure her, and I asked her to give it a try.
The tamoxifen blocks cancer cells from growing. Your body will tell you everything you need to know if you know how to listen. And so this was one of my sort of, coaching myself, so to speak, to try to listen earlier. And so it was a very difficult decision for me. I went to see my optometrist in March, and he noticed that there was some jaundice in my eyes. And one of the side effects is that it can cause hepatitis. I decided to go off the tamoxifen in May after having taken it for about 4 months.
It's a commitment for patients because it's 10 years of therapy for her. And that's a long time to take a drug if it's making you feel bad.
I was certainly brought up to obey authority figures, and that's certainly how I see, my doctors, and I know they're also human beings. And so I was kind of scared to tell my oncologist.
The patient should feel comfortable telling the doctor the truth. And I would say don't be afraid to do that. Just tell the truth about what you're doing so that you can get the best care. Because the doctor might check you differently if you're not taking it. They may see you more often. I feel happy that she felt safe enough to talk to me about it.
her response was just so kind and compassionate, and she said, we would never think that you were failing us, and I don't want you to ever think like you would be scolded for going off the drug. So it was just, it was just so very human. I think that's the kind of care that I've gotten from Epic Care. It's like, these are doctors, they're professionals, but they're also human. I really like my doctors, and I feel very supported by them. I think that once you've been given a diagnosis like that, I think that it's important to realize that, anything could happen. It could come back. But being an optimist, I like to believe that I'm going to live to be over 100. I remember there were days when I was still living with breast cancer, and I would wake up in sheer terror because I thought I might die or I might not make it. And so I think it's just really important to have kindness and compassion for yourself on those days or on those kind of moments, and to really just be optimistic.